Колеги, продовжуємо роботу.
Dear colleagues, we continue working day in the press center of Ukrainian Crisis Media Center, and currently we will discuss results of the election of the new public council of the Ministry of Healthcare of Ukraine. And our interlocutors are Minister Uliana, Suprun, Minister of Healthcare, Lesia Litvinova, and Volodymyr, Flionts, Electronic Democracy and Charity Foundation SVOI. Uliana, Miss Uliana, the floor is yours. Thank you. Good morning. Today we would like to discuss the results of the election of the new public council under the Ministry of Healthcare of Ukraine. Openness and transparency, our principles, which are decisive for the work of our ministry's team. We are always open for cooperation with civil society organizations, with medical associations, and with the patient associations. The format which existed before these elections was not constructive. It did not allow constructive and efficient cooperation and work between us. Now we decided that that 35 NGOs and other organizations which should be members to the public council in line with the CMU regulation. And we allowed elections via internet, and we have got a rather unexpected result, absolutely new membership representing patients associations, medical institutions, pharmaceutical associations, etc. Yesterday we submitted to the parliament the draft laws about state guarantees about reimbursement, state reimbursement of medicines. Unfortunately, yesterday MPs failed even to put those draft laws into their agenda. Now I hope that this newly elected NGOs and civil society organizations will make pressure upon MPs and convince them that this finally should be done after 26 years of Ukrainian independence. And unfortunately, I do not see many TV channels here, but these elections, which were held recently, prove that the Ministry of Healthcare is transforming. Now we pursue the principles of openness, transparency, and now I hope that those newly elected NGOs to our Public Council will make necessary pressure on the MPs and push them to vote for this draft law, which introduces changes to the budgeting for healthcare. And unless this is done, we would not be able to procure necessary medicines for our patients for the next year. And currently, unfortunately, our children with cancer and other diseases have to go abroad for treatment because we do not have this package of legislation which would support their treatment in Ukraine. Now, I would like to Volodymyr Flionts to add a couple of words how that open voting took place in the internet. I'm head of the electronic democracy team, which developed software and who observed and monitored the voting and facilitated it. There were a lot of questions whether the voting via internet would be representative, whether the public council would be representative. In course of voting, which lasted during one day, almost 15,000 votes were processed. Quite often when the public council is elected, the election room can house not more than 200 people. 200 people who participate in voting, while we involved almost 15,000 people. This schedule shows the monitoring process, and it shows that this was real voting. This is the result of our analysis showing geography of voters, and not just big cities participated in voting, and we can observe that small towns also participated in voting, even from Crimea, because Crimea is Ukraine. And then we analyzed the gender spectrum of voters, and we can assure you that both genders were represented equally, and all categories of population, age categories of population. This split shows that social networks became the main source of information for those who voted, and also mobile operators were represented fully. All mobile operators available in Ukraine. These are the split by operators, and you can see that there were this plain diagram, plain line shows that there were no any interferences, and after Maidan, there was a huge splash of civic activities when people believed that they could interfere in the processes in the state. And they understood that we should step back from the centers of influence and start to lobby the policy formation, influence the decision-making via civil society organizations, which should be representative. And behind these civic associations, we have real people who know whom they will represent and what they wish to do. I'm Lesia Litvinova. I will speak Russian. This will be a bit more quicker. I will start with the Facebook issue. Unfortunately, mass media appeared not to be interested in the election process, and that's why the majority of voters were represented via Facebook, and we had no other platforms to inform people. But nevertheless, this was done in your way. This was interesting, and this allowed to invite to elections those people who are new to these public councils, who would never make an attempt to participate in elections and to be elected and apply for election, because they believe that the public council was some sort of elite. The majority of those who applied for being elected, these are, so to say, field organizations dealing with rehabilitation of ATO soldiers, of oncology patients, with those who are really in need. These are people who know the situation of, at the level of grassroots, and the next week we will come together, represent ourselves to each other, get acquainted, and decide what we would like to offer to the ministry. And then everything will depend on the ministry, on the degree how they are ready to cooperate with us. Thank you. I would like to add that in the ministry, from the very beginning, we cooperate with the patient organization. They are fully involved to our decision making. They participate in decision making about new protocols, about some new rules. We fully understand that the ministry is slightly separated from broad public. We exist in the governmental district in Kiev. We cannot communicate with people directly because there is 40 million of population. That's why for us it's much more helpful to communicate with patients' organizations. Quite often we visit on daily basis hospitals, ambulances, A&E departments. Quite often we visit the oblast hospitals, the district hospitals, and after such official visits, when we communicate with administration of those medical institutions, we meet with patients' organizations who present their vision of the situation at local level. Here in Kiev, patients' organizations provide us with that information which won't be otherwise accessible for us. Here today we have parents for vaccination program. Last week, 2 weeks ago, there was the European Vaccination Week, and this is a good example of our cooperation. Then we fully cooperate with the Parents Association of parents of children with orphan diseases, and those parents are very knowledgeable in the issue. They provide to us aid in drafting of necessary rules, decrees, legislation, etc. I hope that the patients' organizations will actively work in our public council, will provide good advice to us because in some aspects they are more are better informed than we. Our objective is to make the healthcare working, the healthcare system working, and I believe that the patients are the best advisors to inform us for decision making. Can you please mention some of those organizations which will comprise the public council?
The order is published this day, and I won't tell you about all 35 because it is too long. You can see this information on the site. You can find a lot of information there. It is in open access. You said that the ministry should help and cooperate. I have a question to you. Top 3. What should be this cooperation? The ministry, and what is the main focus of attention, what it should be? Do you mean first 3 areas we will be interested in, or main issues that we are going to resolve? So what is the main focus? I won't tell you, because the order was only today, and before this we had only talks, and then we will have committees, councils, we will establish areas of work, we will elect the head of the council, and then we will speak about the priorities. Concerning the cooperation with the ministry, the only thing we really need is an open contact. We are ready to work, the ministry is ready to work, and we want that it will be live dialogue without red tape, and also we want to work with the people from the region. This is 1/3 of those who entered community council, and if we try to hold regular meetings, that would be impossible. We will have online voting and Skype conferences in order to contact and to have this contact once a week, not once in several months. So if, of course, we have opportunities provided by Skype, I would like to ask about non-voting. Yesterday in the Supreme Council that there was a lack of vote in order to put this issue on the agenda. And what will be the further steps? What will be the fate of this package? Please comment on this. As I said, we need that the draft laws be voted for till the end of the session. When we postpone, even to put it on the agenda, we won't be able to follow the timeline and reach our deadlines. And we want it to be put on the agenda, to be discussed at the level of committees, at the level of the working group, because before this is just an abstract issue. That's why we are going to speak with deputies. We want to thank People's Front. We want to thank Samopomich faction for their strong support. And we saw statistics. These are those who support this. They have better understanding of the issue. I would like to inform you that these draft laws They are not new. They did not happen yesterday. We discussed this concept for a long time. The concept was adopted in November in the Cabinet of Ministers, and we worked on the draft laws, and we had it for public discussions, and it was registered on the site at the Supreme Council for months, and when there was a lot of time in order to provide advice, to apply, to create working groups, to make improvements if they see some problems, and they didn't address us. And now, when we try to put it on the agenda, it looks like people's deputies saw this for the first time. So this maybe reflect the overall interest in the reform of the healthcare sector. And also I would like to draw attention to the fact what happened in the United States. They want to replace Obamacare at the level of the President, Senate, Congress. Each day they discuss these issues, and they also discuss it in the media, and they discuss this issue. And in order just to change some things in the system that works really well. And we have an efficient system that does not work for 25 years, and we cannot even put it on the agenda because we do not have interested MPs. This is a sad news. And I think that one of our main we would like to cooperate with the Council and to get more support from Joe's concerning reforms. You know that after Maidan, for the last 3 years, they say about treason, and maybe we should work on positive things. This is not treason. This is the only way in order to improve lives. We are speaking about pension reform now, and this is good. We will give more money to our pensioners, and then they will give this money to doctors and pharmaceutical companies, and they will earn more. And poor pensioners won't have financial guarantees concerning healthcare. And all those reforms, they are interrelated. And we do not want to have the situation that is now in the education. And you know that there is 1,200 amendments to the draft, and they continue to provide these amendments. And our students, they are deprived of opportunities, and school children also deprived of many opportunities because of this. That's why we should improve this. So each year more people die than born, and part of people go out the country, and we do not have stability and financial guarantees concerning healthcare. And how can we attract investors if they are not sure that the employees will be protected and that they will be provided with good health care? And this relates to productivity, and this is in all areas in our country. And you see that in this hall we do not have many people today, and if people are not interested, the ministry cannot do it on its own. So we started this day from the presentation. They presented the materials to the presidential administration and to other official bodies, and we hope that the council will be able to cooperate with top officials and governmental bodies. Thank you very much for this information. Let's fight together.